India continues to battle a growing coronavirus emergency. As we said, more than 45,000 new cases have been reported, its biggest daily jump. But the World Health Organization is praising India for its efforts to fight the virus. For a closer look at coronavirus controls, let us speak with Professor Dale Fisher, and he's chair of Global Outbreak Alert and Response Network at the World Health Organization. Professor Fisher, thanks for joining us this evening. First up, what does New Delhi's decision on monthly serological survey tell us? Are we seeing perhaps maybe a changing tack in dealing with COVID-19? So from steering clear of the virus to now a hard search for antibodies and immunity?
I can't really speak specifically for the Indian situation. I don't know why people would do monthly serology. And it really, the number that comes out of that depends on who you're testing. If you're saying that the serology tests were 20% positive, it's quite possible that some pockets might have high levels of past infection, perhaps be 60 or 70% positive, whereas others might be very, single figure, 2 or 3%. So it needs to be interpreted. If you're looking for herd immunity, you might find herd immunity in some areas where there's been a lot of transmission. But in India, and in fact all countries, are very heterogeneous in terms of their transmission.
So, Professor Fisher, on the point of herd immunity, so much has been speculated about gaining herd immunity in various countries. Are we at that stage where we can talk about this?
Well, we're closer than we were, but still a long way. I still think a vaccine is more likely to get here before herd immunity. If a country is sitting on 5 or 10%, which is much more likely, and I'm sure it'd be lower in Singapore. You've really got to go through a lot more heartache to get to the necessary 60 or 70%, which would be herd immunity. So it is better to maintain the current interventions, if you like, so that we get to herd immunity by vaccination rather than by natural spread.
Professor Fisher, has the WHO's yardstick in assessing a country's efforts in handling COVID-19 cases changed?
There are a lot of metrics being discussed. Certainly looking at the number of cases we now know is at best a rough guide. And we've seen, for instance, Melbourne that was having very few cases while it was locked down and they had social restrictions. As soon as they lifted them, there were a lot more cases. So certainly you couldn't assess a country's performance based on its cases. So some of the things we're talking about is, for instance, testing. What are the policies? Are they freely available tests, or are they only available to people with symptoms, for instance? What's the turnaround time of your tests? We're hearing from some of the busier countries like Melbourne, like the US, that it can take 5-7 days, even longer. And by the time you get your result back, you're already better, and probably having passed it on quite a bit. So turnaround time's important. Even mortality is probably well underestimated. We can see that all-cause mortality is actually significantly higher than usual baseline mortalities plus COVID. So obviously there's a lot of COVID deaths not getting reported, or else people are dying from other things because of the COVID outbreak. Another good metric would be cases that are diagnosed while in quarantine. If with your contact tracing you identify all the contacts quickly and they're quarantined, and then they develop symptoms and get diagnosed, then that would be a very good metric. And that's a very common one we use, particularly in Ebola outbreaks and things, that we want cases, when they're diagnosed, they're already in quarantine. So there are many metrics that are being looked at that aren't just the case numbers and the number of deaths reported.
As you alluded to earlier, Professor Fisher, the focus continues to be on this development of a possible vaccine. And we hear that there are reports of at least 4 promising vaccine projects, plenty more in the pipeline as well. Talk, though, of a vaccine by the end of this year, perhaps. What's your take on that?
Well, the truth is there are vaccines now, if you wanted to look at it that way. There's 130 vaccine candidates, and there's 24 that have been developed and they're in clinical trials now. That was the last time I looked, about 2 days ago. There's 4, I think, in phase 3 studies. So the most of the 130 are still at sort of laboratory type development stage. The other 24, or the next 24 of those, might be in like phase 1 studies, and that might be like less than 100 people. And that's where you might even modify the dose a little bit. And you're really just trying to see if on a small number of people it's safe and ideally if it's effective. But then really phase 3 studies are when you might test on perhaps tens of thousands of people, where you can look for side effects that might be less common. And you really need to do these studies before you can ramp up testing and start distributing. So the short answer is there are vaccines now, but you'd never give them to anyone outside of a trial because you need to prove that they're safe and effective, and that's what takes the time. So I feel a little bit sorry for the public because they keep getting stories like, will there be a vaccine in the next few months? And the question should be, will there be a safe and effective vaccine identified, registered and produced in quantities available to give to large numbers of people? And the answer for that this year is no, there won't be that.
Indeed, everyone's looking out for that. But thank you so much for speaking to us, Professor Dale Fisher, Chair of the Global Outbreak Alert and Response Network at the WHO.